All right, well, we're a little bit past the hour, so we'll get started. We have Lee Palmer here from Create Better Health, which is Utah's SNAP education program. Lee, I'll let you introduce yourself a little bit more. Welcome.
Great, thank you. Thank you guys for having me. I know I was able to meet some of you at the forum earlier this year and a little bit last year, but I'm excited to be able to share a little bit about Create Better Health. So just I guess introduction there is so I'm Lee Palmer. I manage the SNAP Ed program for Utah. And so for Utah, it's Create Better Health, and we do programming across the state in every county. Ranging from direct education classes and from the lifespan from 3 years on over to older adults. So we kind of try to cover the whole lifespan and really just focusing on improving food access to SNAP eligible individuals. So focusing in on what those health disparities are and how we can address that to help improve food security. And that comes in a lot of different varieties. I am a registered dietitian as a background, and then I'm also a faculty member over at Utah State, and work with the Hunger Solutions Institute as a co-director. So, food security is just my world, and I love talking about it and finding solutions and working with partners to support our communities. So, that's a little bit about me. But I wanted to share a little bit about what our team does. I'm definitely just being a spokesperson for our team. They're the ones I have a few pictures on this slide, but these are the team members that make the magic happen. They're working in, I have ambassadors in every county who are serving their communities, and they're the ones that are really advocating for their community, what the local needs are, and creating their programming based off those community needs. So we do have kind of a large library of resources that are consistent. We provide very evidence-based information for them to use, and then they pick what is most needed in the county. So working with the ambassadors is really neat. We really focus in on what the partnership looks like and customize that based off the partnership needs as well. So we are Utah SNAP Ed program. Some states have, so every state has a SNAP Ed program, and that's the education side of SNAP benefits, or formerly called food stamps. And every state has a little different dynamic. For Utah, there's one implementing agency, and so that's Create Better Health. And that is why we're in every county. And it is nice in that sense because we are able to have consistent and be more effective and efficient in our systems, and so hopefully spending more funding and resources on our communities rather than that administrative burden. So that is a little bit of Create Better Health in a nutshell. Our mission is to work with partners to provide food and nutrition education to people in need in a way that inspires public confidence and supports American agriculture. I highlighted a few of those key actions that we try to do is really focusing in on partnerships. We know that collaboration tends to be more effective than everybody reinventing the wheel over and over. And so we try to really emphasize that partnership building. We provide that food and nutrition education. And then we also want to inspire public confidence, meaning we want to show that we are evidence-based. We want to provide information where we're kind of an information heavy media world. And so being able to be a source that people can depend on and build their confidence in, and then supporting local and American agriculture. So our approach is a more of a comprehensive model. So we don't just do education, we don't just do projects, changing environments, and we don't just do social marketing. We try to combine all of those in different ways to have the greatest impact. And we've done several different studies on that and how a comprehensive model and having multiple touch points ends up having a higher impact on low-income individuals. So this is kind of just a visual of what that could look like, but that also again depends on the partner and what their audience looks like as well and what their needs are. So just a kind of overview of food and nutrition security in Utah and kind of what inspires us and helps us guide what we do. is that we do see a lot of higher rates in some of these audiences like children, single parent households, older adults, seniors, people with disabilities, and then the Black, Indigenous, and people of color communities. And so a lot of our programming, we have our standard programming, just basic English standard programming, but then we adapt it and do a lot of research that's community driven to adapt it to each of these different segments. And so there are a lot of variations to our programming depending on who we're working with at the time. We
So these are
one
higher rates than compared to the national.
We're higher rates just in general of the population. So it's
Oh,
going to be rather than kind of your typical family household, a full household, that's going to be, you're going to see higher rates of food insecurity among these ones.
got it.
Yeah, great question. And the 70, this data point right here is there. So we've got resources for these low income individuals, one being SNAP, so those food stamps is what it was formerly called. Um, so that kind of helps with some population, some part of the population, and that there is limitation to that. They have to be under a certain income level. But then within that, there's only 79% of Utahns who are eligible for SNAP who are actually utilizing it. So there's a lot of individuals in Utah who could be utilizing more resources. They don't, and there's a variety of reasons for that. We've seen ranges from just not being aware of the resources to kind of the stereotype and the stigma behind using resources, all the way to they have other support systems. So there is a range of there. But we want to emphasize just that SNAP impact on what and on food security especially. But when we're looking at the research behind SNAP and SNAP Ed, we see that it's reducing obesity, diabetes, heart disease, and other diet-related chronic diseases, which tend to be higher rates and correlated with low income as well. With SNAP, we see an improvement in mental health. We see an improvement in physical and cognitive development with youth. We see an improvement in economies. So, for example, with every $1 spent with SNAP benefits, you see there's been about a 179 reinvestment of economic activity within the communities. So you're getting kind of that federal funding coming into the local community. And additionally, they did some ROI research and saw that every dollar spent in SNAP benefits also reinvests and saves about up to 879 in future healthcare cost. So there's that initial investment that the federal government does, and but the benefits and if we can get our communities who need it the most to utilize it is not only that they build themselves up and kind of get that hand and elevate their own lives and meet those physical needs, but also it builds up our communities as well. So lots of benefits to that. I lost my mouse here. Sorry about that. Okay, and so I just kind of wanted to connect it back to the farmers market and the role of that SNAP-Ag can connect with farmers markets. So farmers markets and food security especially are just a phenomenal avenues for addressing food security. So we see that those farmers markets are strengthening the local food systems. We're seeing improved feeding behaviors among youth who are trying new foods. That was a huge, prior to this position, I've been a pediatric dietitian for a while, and farmers markets were my favorite thing to talk through with families, just because it was such a neat thing for these kids to see these foods, where they came from, talk to the farmer, talk to the one who's growing the food, and connect the dots, and then ended up trying more foods and building those healthy habits at a young age. We're also seeing that it increases access to nutritious foods. There's a lot of areas where, especially in Utah, there's a lot of food deserts in the area in the state. And so being able to improve that local access, especially, and kind of connect people to healthy foods is a huge role that farmers markets play. And then it also builds that sense of community connection, which again goes back to improving mental health, improving that sense of being. So there's a lot of benefits that we see on food security just from these farmers markets. So connecting it to what we can do to support farmers markets. We're huge advocates of farmers markets, and so when we can support you guys, we absolutely love to. It can look different in each county, and so what I always recommend is connecting with your local ambassador, and I'll make sure I get that contact information to you. But seeing what would make the most sense for your market. Um, when the kind of the biggest thing that we do is we usually have these booths so you can kind of see what that looks like. And different markets have different setups for that, but we do different indirect education activities, which really that's just spotlighting produce. And our hope is that we're encouraging participants to and clients to go purchase local fruits and vegetables, especially. We want to encourage them to support the local farmers and the families in need. Our focus is on consuming fruits and vegetables, and so this is a perfect space to be in that environment of teaching. We educate on how to utilize the produce, so sometimes we get different fruits and vegetables that, especially individuals on a tight budget, might not have the time or the capacity or the finances to explore with foods. And so you think about like if your budget is so small, you're probably not going to explore a bunch of recipes with new and try new things. And so what we try to do is have samples. We try to encourage them to try something new without it burdening their budget. We also connect and invite them to attend SNAP-Ed classes where they can continue their learning on how to utilize foods, how to stretch their food dollar, with just really that resource management side of things so that they're able to live a healthy life even when they have to live on a tight budget. And then we also provide lots of recipe cards. So we have plenty of recipes that a lot of times what we'll do is try to connect with what types of foods are common at that market and then bring recipes that will highlight those fruits and vegetables that are typically there. One of the programs I wanted to highlight is the Buy Produce for Your Neighbor program. What we do is we really encourage the farmers market patrons to support the local farmers, those who have the resources to purchase extra and then donate it to families in need. And so what we'll do is have a buy produce for your neighbor drive almost. So we'll have a bin at the booth where patrons can go purchase extra food, put it in there, and then our ambassadors take that produce and bring it to the food pantry. Typically it's a food pantry, but sometimes there's other partners like low-income housing units or community centers that will take it to that so that you're improving the access of healthy foods and you're also supporting local farmers for those who have the capacity to do so. That process looks like putting marketing out. We've got different marketing materials that we put up. And then again, those participants purchase the foods and then our ambassadors take care of delivering it to the local food pantries. When we look at which farmers markets to work with, we do have a few restrictions. One is that they do have to accept EBT in order for us to be there. And so if we're always happy to help coordinate connecting people to getting set up for EBT with the partners that do get that set up. But that is a requirement for our program, but then it's also preferred that they're getting involved with Double Up Food Buck program. And so the hope is that we're really encouraging our SNAP participants um, who are already on a low income. We want them to come to a market and be able to double what they have on their SNAP benefits to get more fruits and vegetables and maximize their SNAP benefits and then also bring more revenue into the local community. So we are focused really on those low income individuals who are SNAP or SNAP-Ed eligible. So they don't necessarily have to be on SNAP to participate in our programming, but we do focus on those who would qualify. So what partnering with Create Better Health could look like can be based off what your needs are. We want to make sure that we're being a support system to you guys and not an extra burden or an extra task. So you can kind of customize it what makes sense for you, but we want to just provide resources and hopefully quality to your market. Some simple things that you could do is we have a lot of healthy tips and recipes that if you just want to share that with your patrons on social media channels, you're always welcome to pull from our social media pages and share that out to your patrons. Um, if you want more in-person type work, we can meet with your county ambassador to discuss what project would make the most sense, whether it's the buy produce for your neighbor, if it's some type of food access project that would improve, especially low-income individuals to connecting with the farmers, we can discuss what that could look like. If you have enough of manpower that you feel like you could do the drive itself, the buy produce for your neighbor drive, and you just want the marketing materials for it, we can just drop off those materials, and then it could be as simple as just dropping them off. If you want someone to come drop those off and then come pick up the food at the end of the day, we can have that happen. So it just depends on what the need is of your market. We can print out recipe cards for patrons, and that can be either done if we have a booth there, we can have that with a food demo, or we can even print out the recipe cards and have it at the um, different farmers' booths so that it's here's your produce, here's a recipe card to go with it. So you can kind of customize that. And then we do have different materials to share out classes and continuing education opportunities at the EBT booth so that we can get more awareness, education, and ability to manage their resources, food resources especially. So for our social media, we do have a pretty comprehensive, vibrant social media. Every county has its own social media page. And so if you want to look up your local one, you just put in Create Better Health, whatever county you're in, and it will come up with a Facebook page. We've got a Instagram page for most, and then we've also got the refugee and youth or parent focused pages as well. The QR code that I have got there is kind of a tree link that will take you to all of them. So you can kind of pull that up and see what's going on. We try to highlight a lot of education pieces. We highlight what SNAP outcomes are, what's benefiting, how you're seeing people use their food dollar more effectively, kind of tips, recipes, all sorts of things. So it's kind of a fun area to just be aware of what options there are. We'll highlight what resources are out. So if there's a class that's coming up, an event that's coming up, we'll promote those on all of our social media pages. So a good place to just be in the loop on what's coming up. And then the last page, I just wanted to connect, I put my email up there. You're always welcome to email me to make those connections. I wanted to put the picture of my whole team up there. Just they're the ones that you'll be able to meet and connect with. They are just phenomenal people in general, but they are just amazing advocates for their communities. And so I think there's not anyone on our team that I wouldn't trust to really be dedicated to their communities. So I'm happy to connect you with whoever is needed. You're also welcome to look up the kind of the local page. And then if there is also just you need to brainstorm on what a program could look like at your market, I'm almost always happy to discuss that as well. So lots of different variations, but the goal is really to support the farmers markets because we know that those farmers markets are really improving that food access to low-income families in Utah and supporting local agriculture. And so that's right in line with our mission, and we're here to support that. So with that, I can answer, I don't know if there's any questions now or, and then you can also email me if you're watching the recording later.
Thanks so much, Lee. So if a market manager wanted to connect with Create Better Health, the best way would be to either just connect with you and find out who their ambassador is in their county, or if they go to this QR code, would that does that bring up the Create Better Health website?
It does, yeah. So that brings up the whole website with if you want to connect with a certain person, I would probably just email me and I
Okay.
can connect you with the right person. Depending on what the county dynamic is, sometimes they'll designate a different ambassador for like farmers markets versus other programming. So just to make it easy for you, if you just want to email me, I can connect you to the right person.
Great.
Yeah.
Any questions for Lee?
Hi Lee, thanks for this presentation.
Yeah, absolutely.
I was just this curious. This is kind of an opinion question. So, and maybe for everybody too. Um, oh, I realized I'm not visible. Well, whatever. Um, I was just noticing that in our specific, and maybe Salam can talk to this too, in our specific market, I love the idea of buying for your neighbor, and we could totally implement that. And I'm actually interested in doing it, so I can follow up after this.
Yeah.
But we often get people who are like hungry in the moment. Like there's like
Hmm.
almost an emergency aspect to it. And I don't want to complicate the market by like giving out food. That's why I wondered if Salam had a good thought. But at the same time, like there aren't many food banks open on Saturdays. And so it happens, I'd say every couple of weeks where we have somebody and we don't really have a resource. So I was wondering what your thoughts were on that, and or like somebody's out of their EBT. So then we can't give them double ups. I don't know that you have an answer, but I just
Yeah.
wanted to kind of put this out there.
Yeah, no, I think that's a good point to think about with the buy produce for your neighbor. As far as getting it to the pantry itself, our ambassadors they'll coordinate that time. So if drop off isn't until Monday, they can collect it and then worry about the drop off time. But actually, as far as access goes, if there that could be a PSC, what we call PSC project, is looking at essentially any project that improves access by changing a policy system or environment is what that looks like. And so if that's something that we want to explore a little bit more, I'd be happy to kind of brainstorm a little bit with you, if whether it's looking at doing a drive and the distribution is actually at the market. We could look at something like that if you're interested in that type of work, or if we have a couple projects that are we're trying to start up with. It's a couple places will do either Adopt a Box or we call Nourish Box, and it's kind of a self-serving pantry, kind of like those angel food box type things. And we could the tricky part with that is we have to have a host, otherwise it falls apart pretty quickly. And so if that was a partnership that you guys wanted to have kind of a self-sustaining, which is nice on those areas where food pantries aren't open 24/7. And it's also takes a lot of that stigma away because you can go get the food whenever. There's no questions asked. You just contribute when you can, take when you need, and we don't regulate who and when and how much. So that could be a partnership that we look at. So as far as actually getting the food to either patrons or people that you're working with, I could see that being a PSE project that we could
Okay.
partner on.
Okay.
Yeah.
Um, just to add to that, we actually run a pantry out of our Saturday
I
markets.
thought so. Yeah.
Oh, very
So,
cool.
but also to that end, we do need support in sustaining that market. We run it for this very reason. We have a population that is food insecure in a lot of ways, and we have this amazing opportunity of having this very fresh and culturally relevant produce available to them. But we do, speaking of any policy procedure support, New Roots needs help in sustaining that program by finding volunteers to sustainably run it. It's a high demand pantry.
Mm.
I'm actually working with the people with some other food pantry runners to see like what they're doing. So any support in that, but yeah, I can see how like taking on one more seeing. Ours fortunately is it's built into our system. We have a food pantry right there on Saturday. It's not easy to run. It is something that I wouldn't just be like, that's your solution, because that's something I'm trying to figure out how to sustain, because it is hard to manage.
Yeah. So to your, but I guess what I wonder from you is like, how does that impact your farmers, or like the traffic? Like, do people, there's this balance where you do want to serve the folks that are in like a food crisis. And I've been trying to figure out how to do that, but then at the same time, like, you don't want to take away business from vendors and have it
Mhm.
does it feel
We
like there's a
have,
balance?
yes. Rarely do we have any fresh produce that is part of
Mm,
the pantry. We have our pantry
mhm.
sustained by food pantry items, but also
Got it.
we have very much normalized our food insecurity or food initiatives. So nobody is going to bat an eye if you happen to be in this line and that line. It's just how our market attendees
Sure.
work. And
Yeah. Okay, that's good to know. Yeah, I think that's a smart,
And
like,
a
that
large
kind of
time
goes.
too, our farmers
Yeah.
are also like it's food initiatives are very much normalized. If you ever have any like concern about how will it be received, I say you just normalize the heck out of it, and then nobody bats an eye. Nobody would bat an eye.
Yeah. You have a bit of
I
a
love that.
different group, but yeah, I
We
agree.
do.
So, but I do like the idea, or it goes back to the Nourish Box thing, where it's like, if you're in an emergency, you can have these pantry items. I don't want to, like, it's not that I want to take away fresh produce from somebody who needs it, but at the same time, I wouldn't want to like undermine farmers who are selling fresh produce and then be giving fresh produce away at the market.
Hmm.
So that makes
Right.
sense that you do pantry items.
We do pantry items largely for our, but yeah, the Nourish boxes. We do have people donate vegetables to our pantry. Sometimes it's neighbors, and sometimes it's the farm. There are people that donate produce, but largely we're operating that out of pantry items.
Yes. Cool. Thanks, guys.
But I would love to touch base, Leah, on about some troubleshooting on our pantry. We, if anybody has any idea, we just need to figure out a way to manage that better. We don't necessarily have the bandwidth to keep two staff members there, but maybe that looks like support in staffing or ideas about how to secure like volunteers that are regular and could do this, because it's not easy.
For sure. And I'd love to, if you want to email me, we can kind of brainstorm some ideas. We do have like
Absolutely.
what we call it it's kind of a coaching guide for us, and we can go through it's a scan of food pantry specifically. So we have a create healthy pantries as one of our focus areas. And so that might be a good fit for that one, is to just do a scan of what is the current state, what your goals are, and then here's some options of different connections or program activity ideas for our ambassadors to get involved with, or partners that we're involved with that we can connect to you. So that can be kind of a nice starter point of what potential
That would be awesome.
support.
I'll
So
email you
yeah.
after this.
Okay, great. Awesome.
Thank you.
Hey, it's Denise with Good for
Hi,
Life
Denise.
Markets. How are ya?
Good.
Good. Hey, I was really excited to see the addition of the Sunbucks this year for the kids.
Yes, I was too.
Yeah. Has your office looked into any kind of support or implementation of something similar to or a replica of the POP program? And if you have heard about that at all, the Power of Produce program, and it's run in some neighboring states. And it
Okay.
has run at my market in West Valley City. And it's basically a program to teach children about the power of produce. So
I love that.
I just happened to, I think it's going to go really, really well this year with with the Sunbucks program, and I run a lot of food stamps through my market in West Valley City, a lot in Taylorsville, and I'm opening West Jordan this year, and I think we'll end up with a lot in West Jordan as well. So the city of West Valley actually a few years ago got a grant to run this program, and then they didn't open a farmer's market. I did.
Oh,
So they
okay.
are running farmers market. But it's basically they bring in some volunteers from USU who do an activity, or they'll have the kids taste a fruit or vegetable, or identify a fruit or vegetable, or maybe run an obstacle course, or maybe they'll make smoothies. They even have a bicycle that's attached to a blender that when the kids ride the bicycle, it blends up a salsa. They'll make a salsa in there sometimes. Or they'll make a yogurt smoothie in the blender and then pour it out for the kids to try it. Like, this is how, and then once the kids participate, then they hand them a couple of little wooden tokens that say the power of produce. The kids then go to the farmer with that power of produce and buy, each is good for $1. So they'll get a peach or two, or they'll get a couple tomatoes, or they'll get, a handful of raspberries, or whatever the farmer is willing to give them for $1. And then I reimburse the farmer at the end of the program or end of the night, just like I do with Double Up or SNAP. And then the city of West Valley actually reimburses me because they're the ones with the grant money at this point. But I would like to see that operated statewide, like teach them young, especially now that these kids are being given this Sunbucks. Teach them young that they have power, and they can come learn and go purchase. So it's a pretty neat program, and we get kids that they wait for that 5:30 to open. They're like, "Hey, we're here for the pop program," and it's incredible. It's quite a draw. Yeah.
Yeah, that's a really good example of partnership. So that's our team with the smoothie bikes is we have some of those across the state, and so that's our ambassadors who are going out there. Either the ambassadors or their supervisors are typically those ones that are getting involved with the that project, and so that's a perfect example. And that's something that if you have a booth, so a Create Better Health booth, I've encouraged we've kind of trained our team on what programs are out this summer, especially the Sunbucks, and really focused on Double Up food bucks, different things like that. And so they can do those activities if you have a Create Better Health booth there, and have them focus in on they may not use the term like the pop terms since it's not that partnership there, but they can focus in on youth programming with that same activity idea. So we love doing those.
Those I want those at all of my market. I want those, especially, it might not, I might not have as much food stamp use in Highland, but I'm really want to figure out how to implement that. And I know there's a grant that's out right now that I might look into, but West Jordan, Taylorsville, and West Valley, especially this year. West Valley's already a go, but West Jordan and Taylorsville, I'm just trying to figure out, like, how can I pay for this to happen at every market? you know?
Yeah.
Because there is a cost associated with reimbursing those farmers. So
right. Yeah, that's the tricky part is like, and I love that collaboration method because there's some resources that partners will have and some that we can supplement with. So like for us, we can come in and do that education activity portion of it. And then if there's a partner that can provide those tokens, then, that's such a great collaboration right there. And then you hosting the actual site there. There's a few different ways that we can collaborate on that. And there's that would be a discussion too with when you request the ambassador to be at the booth, just saying, I want it to be a focus on youth activities, and they can easily do that.
Okay, thank you. That's great.
Yeah, you bet.
You do the Pop Club Adelaide, don't you?
Yeah, I do, but funding.
Yeah.
So I don't
Have
know
you
if I'm gonna
gotten
be able to
funding
do it
for
this
that
year.
in the past?
Yeah, I got grants last year and some of that I haven't gotten yet this year, so I don't know if I'll be able to do it.
Got it. Yeah, and I put the link in the chat to the Farmers Market Coalition Power of Produce program. So they give you a bunch of tools. It still is, you know, one of the things that draws kids in is they usually give a like a token or, you know, or a printable $2 pop book template, so that kids can do some sort of activity and then they get to go and shop. And that's, you know, that's kind of one of the big draws, but I know you really need funding or some sort of sponsorship. You may even be able to talk to some of the larger, you know, vendors that you have and see if they're willing to sponsor that kind of program. I mean, you'd have to do some math to figure out maybe it's just the first 10 or 20 kids a day or, you know, something like that. But there are ways to figure out how to get some sponsorship money for that, or maybe even just getting some produce that's given for, you know, donated for that day or something like that. But
We'll
that,
probably, oh, sorry.
no, go ahead, Adelie.
We'll probably have the funding to do the activity part, just not the bucks part. The
Yeah.
sad part is that like part of the reason a lot of kids do it is like then I see them give the money to their parents. But anyways, that's a whole nother
Yeah,
conversation about food insecurity.
yeah.
The complex one.
Any other questions for Lee while we have her here? Well, thank you so much.